engaging children and young people in shaping the way health services are developed and run is absolutely critical. Health services don't normally engage our young people. They feel that their services are judging them, they feel that the staff don't listen, and they're particularly worried about things like confidentiality. We've known that for a long time, so now we need the evidence to be able to change the way services in Nottinghamshire actually operate.
Well, Nottinghamshire County Council is committed, and has been for a long time, to young people having a say and participating in influencing services that affect them.
Nationally, the Department of Health produced some guidance around making health services young people friendly. That was called You're Welcome. We took a paper to the Nottinghamshire Health and Wellbeing Board to gain support for being able to implement that locally. One of the ways that we wanted to implement it was to train young people up as mystery shoppers, to go undercover into a range of health services to tell us what they really thought. Are these services young people friendly or not?
Well, young people are service users, and if you want to get your services right, whether that's in terms of health services or youth services or any other kind of services that they use, if you want to get those services right, you have to listen to the people who use the services. And that's the same with everything. It's not just with young people, it's just that often young people don't get included in to that kind of consultation and that kind of exercise.
As a commissioner, I commissioned the youth service within Notts County Council to lead on the development of the Mystery Shopper programme for Nottinghamshire. They were brilliant. They engaged about 20 young people aged 13 to 19 and trained them up to be mystery shoppers. The young people were engaged in a weekend residential where they had loads of training around what do they expect from services, issues to think about around confidentiality, around the way that staff look at them, talk to them, whether they smile or not, things about websites, what is it that young people want to see on a website and how do they want to be spoken to when they are on the phone. So if they're making an inquiry about something, they want to be able to be listened to and to be able to get the information that they need.
So we went on a health residential before doing the inspection just to learn about what we would be doing. So that involved learning how to use the cameras, learning about what health services should provide. So they should be welcoming, they should have certain leaflets and information for you to access, the staff should be friendly, and we also did some role playing of different scenarios that we might practice when we went with each other. So it was fun, but it was also educational because we learnt about how they should respond and what to look for that's good and bad. So that made it easier when we were inspecting to think about how well basically the services had performed.
On this residential we'll be doing role plays to help us when we start the mystery shopping. We did it mainly on doctors' surgeries, and we were just looking at what made a good receptionist. So in the role play I was the doctor or the receptionist.
Yeah, and I was the patient coming in with a particular problem.
And basically we just had to try and do a bad sort of experience and a good experience.
I'm looking forward to actually putting our training into work, so knowing that all this hard work at the weekend's actually making a difference.
We found it really useful to have video cameras on site so that young people could film straight away how they felt that service dealt with them. So they use the video cameras outside of premises to be able to capture that initial feedback. We found that really, really useful because it was immediate and the young people didn't forget how they were treated and what their initial feeling was about that service.
When I first started doing the visits, I felt awkward because they didn't know who I was. And after I did a few, I felt more comfortable doing it.
The whole experience was different, but at the beginning I was excited to see how they treated me. But then near the end I realised that most adults that work in health services aren't young people friendly.
When we walked into a service we found that because the centres were actually quite small, the reception was located most of the time near to the waiting area. So in order to get to an allocated room for the C-card service, for example, you had to speak to a receptionist to tell you where to go. So by that point everyone or people around you knew where you actually wanted to go.
In terms of confidentiality, I found that reception staff was talking openly about what I'm here to discuss with them.
I would say that staff do need further training on working with young people, because not all of them knew how to react when we walked in, and we asked for specific information on C cards or stuff like that.
Overall, when inspecting services, I saw what a range of different services there are. We had some really good experiences, but also some really bad experiences, and there didn't seem to be any link between the particular area or the type of service. In some ways it seemed to be kind of luck of the draw, just who you managed to speak to. So I'd hope the outcome would be that everyone kind of presents an equal level of decent service. I'm not saying everyone's going to be able to be excellent overnight, but if people had more information about what they could improve on, hopefully all the staff would improve.
As a young person, when we walk into a health centre or a youth centre or just anywhere in public, it feels really confrontational. Once we walk up to reception, it was just, usually the receptionist isn't helpful, so that's obviously a massive negative effect on us, because they're obviously the first port of call before we go to anyone else. So if I'm scared of the receptionist, which did actually happen in one of our health visits, then I'm not actually going to go talk to the doctor, talk to the C-card worker, or talk to any of the GPs available.
My worst experience was I went to this place and went to talk to them a bit more about sexual health, and this lady came out and gave us a bag full of 20 condoms. I thought this wasn't right, because we might not have been there to get condoms. We might have been there to talk to them a bit more about something else.
In one pharmacy we went in, we asked about information on C cards, and then they asked us if we preferred a female or male member of staff. So when we said female, she took us into another room and spoke to us one-to-one on our own and gave us as much information as she could.
The C-card scheme is a confidential young people specific health service, and therefore to get young people to access all age health services and test out the C-card scheme was really useful. We were able to identify areas where young people felt we needed to improve, particularly in terms of staff friendliness, information being up to date and correct, and just feeling welcome, non-judged and non-embarrassed when talking about something as personal as sexual health. It's important we get this right from a young person's perspective, because it is a young person's friendly service. We promote it as a confidential service, we promote it as being somewhere to go and ask any questions you have about sexual health, so you don't feel embarrassed, you feel comfortable, and you are able to find out as much information you need about sexual health. And therefore, if the young people are telling us where we need to make the improvements, then it's coming from the people that the service is designed for.
So as well as doing physical visits and inspecting health services that way, we also did telephone consultations and looking at websites to get information. So the websites we'd see if they offered things like the C-card scheme, or over the telephone we could ask, are you a pick-up point, are you a registration point or whatever, and see what information the person could give us and how accurate the website was. For example, one website we looked at said a service was open, and we went at the time it's meant to be open, but it wasn't. So there was some issues with that, but those were the other types of inspections we did.
The ones that the health services that we went to, some of them were closed at the time, and the websites didn't indicate that they were, or vice versa. But some of them were closed, some of them were open, so it was hit and miss really.
So a lot of the websites we visited were really impractical. Some of them had lots of blocky text and others had not even enough information. And then when we visited some of the Facebook like pages just to see if they had better information, it was just not there. So then when we went back to their own website, things like youth clubs and youth centres and even small GPs, they have their own websites, they just don't use them in the right way.
I went to one place, the staff there was very welcoming, but she tried to help us as best she could by giving us leaflets and information. But one problem we did have is that she was trying to get our friend's name, then she could see if he was on her database, because we said that our friend needed to quit smoking.
One of the telephone calls was really good because I rang up and instead of like just giving me the information she should have given me on C cards, she asked my age and like stuff before, which they do anyway when you go to register. So I thought that was really good, and then she also gave me some more information on where like locally I can go if I need anything.
So I would feel more welcome in health centres if there was music in the buildings, because often you go into these health centres with a problem that you might be quite worried about. So if there was something like music to calm you down whilst you're waiting, then it might just put the user of the service at ease.
The most important thing for health services to do to become young people friendly would be to have the first person who you see, so the receptionist or whoever you see when you walk in the door, be more approachable and perhaps ask you if you need any help, if you need any information, if you want to go into a confidential room to speak about something.
A lot of the health visits were quite negative when we walked in through the door, but then a few of them were, the receptionist was all smiley, so obviously you're more likely to talk to someone that's smiling and someone that looks professional, that has a name badge, so you can address them straight away, so they know you're definitely talking to them. But then other places where there were like maybe like 20 million receptionists sat behind one desk, and then as you walk up to them, everyone looks at you. Obviously you get scared because you want to ask for something that you might not feel comfortable talking about, for instance condoms or contraception or just advice. So in those instances it was just really, really, really difficult if we wanted to talk to them.
It's all right conducting this research and the people going back to these places and telling them that these things should be changed from what we have found, but whether it actually does change is a different matter. So if we were to repeat this process, then it'd allow us and the people that want this to be changed to actually see if it has been changed, and if not, then obviously something needs to be done about it.
I really enjoyed doing this mystery shopper because I feel like I'm making a difference, because we're telling health services how they can improve their services and what they can do in the future.
So the findings of the Mystery Shopper report will be shared with the Nottinghamshire Health and Wellbeing Board. We hope from that board they'll listen to all the recommendations, and one of the recommendations is actually to repeat this exercise once a year, to ask providers of health services to complete a self-assessment once a year, but also for the young people to go undercover and to really tell us what they think of those services. The process has been absolutely brilliant in engaging and empowering young people to be able to tell us what they really think of our health services. Without their voice, we will only guess at what they think. So it's absolutely critical that we engage them in service design, delivery and evaluation. The Mystery Shopper exercise does all of those things, and if we really listen to their voices, we can really improve the health services that we have at the moment. We can make them engaging, non-judgmental, and make them a safe place for young people to go without fear of being judged.